Unlike some of the other forms of neurostimulation, what's unique about what we're doing is we're improving sleep onset. So we're cutting the time to sleep in half, but we also improve sleep maintenance. So that's basically in the science community, wake ups in the middle of the night. So we're reducing those by over 35% now. So that's a pretty big deal, and obviously improving overall quality of sleep. And that's what we do.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Tim Rosa, CEO of Somnee. In this episode, we discuss a new frontier in sleep, combining clinical-grade data with personalized neurostimulation. Tim shares how his experience at Fitbit led him to Somnee and why this brain-sensing headband is helping people fall asleep faster and stay asleep longer. Plus, we talk about treating insomnia without medication, Somnee's traction with elite athletes and high performers, and the opportunity to reimagine neurological sleep health. Let's get into it. The Fitt Insider Podcast is presented by EGYM. EGYM's smart fitness ecosystem is transforming healthcare through exercise. Combining strength equipment with AI-powered software and corporate wellness platform WellPass, it's leading the shift to proactive preventative health. Learn more about EGYM's intelligent workout solutions at egym.com. Hi, Tim. Welcome to Fitt Insider. Thanks for joining us.
Joe, excited to finally be here.
Yes, sir. We've chatted a number of times. You've chatted with Anthony. We're certainly personally up to speed on Somnee and what you're working on. But for folks who aren't familiar, maybe just a quick introduction about yourself and the brand, and then we'll jump into it.
Yeah. So I spent about a decade in sports marketing, worked for Sega Sports, ESPN video games, launched 2K Sports. NBA 2K was my baby for a long time. And ended up at EA Sports. And while I was there, I got a call from a little startup called Fitbit. And I moved over there and launched the marketing organization, helped put together the 3-year plan, build that business. Within 3 years, we took it public. It was the biggest IPO in history for a consumer electronic company at that time. Introduced heart rate tracking, sleep stage tracking, turned into a top 20 consumer brand. And then we ultimately sold it to Google. And so in that 7-year span, just to give you context for the size and scale of Fitbit, we sold about 140 million devices. So if you think about that number and some of the announcements that Aura, I think they announced like a, pretty substantial valuation on 5 million units. It gives you the idea for the scale of Fitbit. But after the sale, I took time off and I got a call from Vinod Khosla and Dr. Matt Walker about a startup over at UC Berkeley focused on sleep using neurostimulation. I actually struggled with adult insomnia and was taking THC and CBD edibles and melatonin, magnesium, everything. And I didn't know that much about the category, to be totally honest with you, but I said, look, I'll try it. I actually fell asleep with the device on. And I'd obviously stopped taking, the edibles, but I fell asleep in my second session and I couldn't believe it. It was like magic, but I hated the form factor. I hated the app. I hated the website. It was too confusing. It was very like engineering or scientist to scientist. And, I used to say part of our success at Fitbit was we made very complex things easy to understand. So I told Vinod and Matt and the team, the only way I'll take on the role is if I can reset the whole company, just put together a new vision, including the supply chain, the brand, the hardware roadmap, services, start to bring in people from the category. And here we are. We finally introduced Somnee 2.0 a couple months ago. And that's the segue and story arc of how we got here.
Just contextually, how long ago was that you kind of tried the device and then joined the company?
So that was about 2 years ago, just over 2 years ago. And I went through that experience. And I, my career is in brand building and marketing. I've worked for some really great brands and over the years and especially challenger brands. But I'm very obsessed with the details. Brands are won and lost in the trenches. But the thing that was really unique was they had this incredible science, this incredible technology. They had great patents on the approach. Literally, no one else can do what they were doing. But no matter how good your science is and your research and your technology, if you don't have a good consumer experience and that's your pathway, you're never going to make it. And so it's hard enough when, essentially we're creating a new category of products. It's really like the second or third generation, depending on how you want to look at it, of the wearable category, where you have clinical grade data sets that are literally driving an intervention or an outcome versus a generalized diagnostic that's telling you basic information and providing like trends on that information, but the sensor quality isn't as accurate as it should be. And I think in a time of AI, it's absolutely critical that the whole category starts evolving in that direction.
Yeah, so let's just talk specifically about the device, hardware, software. You mentioned kind of the experience of obviously kind of a sleep and calming focused device. You fell asleep using it, but this kind of big jump from where we were. You talked about Fitbit and even something like Aura, where we're tracking sleep to, hey, what does sleep onset look like? What does the biofeedback look like to help somebody fall asleep? Like, what are we doing from like that actionable standpoint that is different than quote unquote like sleep tracking?
Well, what we're doing is, I'll kind of back up a little bit and explain how it works. So it's a sleep headband. It essentially, we took the technology from Matt's lab, we miniaturized it, put it in a headband form factor. The way it works is we use an EEG to essentially map your brain to determine your optimal state for sleep. We do personalized neurostimulation, and then we do another EEG recording in that same session. So end to end, it's about 15 minutes. And for us, it's critical. Our whole tech stack is built on AI and machine learning. So EEG is essentially EEG and PSG are the gold standards. If you go to a sleep lab, it's the technology that they're using. We absolutely need to have grade data sets in order for our AI models to perform effective neurostimulation. So that's the way it works. And you wear it for 15 minutes, or you can wear it all night. What is the benefit of wearing it all night? You're essentially getting clinical grade sleep data sets on sleep stages, something that no other wearable can provide that's worn downstream from the head. So sleep is managed obviously through your brain, through the frontal cortex specifically. But anything that's downstream from that is not going to provide accurate data sets. And that's just the way it is. And depending on the wearable and the sensor tech and the algorithms, it's somewhere between 50 and 68% of the accuracy of, EEG and certainly PSG. And so that's what we do. And the benefit of wearing it all night is if you're someone that requires accurate sleep stage stat, like no matter what you're, if you have a condition, certainly with insomnia, et cetera, it's really important that you have that understanding. But the other benefit is, unlike some of the other forms of neurostimulation, what's unique about what we're doing is we're improving sleep onset. So we're cutting the time to sleep in half. But we also improve sleep maintenance. So that's basically in the science community wake ups in the middle of the night. So we're reducing those by over 35% now. So that's a pretty big deal, and obviously improving overall quality of sleep. And that's what we do. And so, again, the benefit of wearing it all night is you're getting clinical grade sleep data sets. If you wake up, we have a feature right now where you tap a button, the neurostim activates in the middle of the night and helps you fall back asleep, which is a great feature. We have some things that we're doing with our AI models, so that's automated over time, but that's in a nutshell, that's what we're doing, and we're having a lot of success. We're slowly moving into some interesting areas, certainly around sleep performance with professional sports teams, et cetera. With the NBA just did an investment in our company. We're rolling out across the league right now. So
We started talking about the kind of broader category as like neuro wellness. So there's all different types of ways that we can tap into the brain as a biomarker and biofeedback and interventions, like you were saying, to help you fall asleep or focus or meditate, all these different things. As it relates to Somnee, what was the kind of zeroing in on sleep like as the main focus, as the area that you were going to say, hey, like this is how we can improve your life versus maybe other areas of tracking or ways in which like the brain functions?
As I mentioned, so we're directly influencing the frontal cortex. Frontal cortex manages sleep as well as a number of other conditions. So anxiety, depression, cognition, memory, focus, etc. So ADD, early onset dementia, Alzheimer's. So there are a number of things that you can do with that. But when I came on board, and certainly there's research that's been happening. I mean, the team, the science team, spent 5 years of research and development before they even came to market. I mean, they were looking at different forms of neurostimulation. The last company that Dr. Ram and Dr. Knight created was Neurofocus, where they use EEG to read your brain, understand your feelings and your emotions for research purposes. They actually sold that company to Nielsen Media. It's the foundation for all of their cognitive research, where you're getting real-time data that is accurate. Previously, when I was at Fitbit spending hundreds of millions of dollars, you have a margin of error that is a roughly 15 or 20%. You have lagging data sets. So that's what they were focused on. So when they started Somnee, they looked at, okay, we understand the brain, we understand like the conditions, but how can we influence the brain, in particular the frontal cortex? And so that's where they landed on this form of neurostimulation. It's TACS, it's an alternating current, which allows for a lot of personalization because, as Matt says, we each of us are our own unique snowflake. Every body, every brain, every day is different. And so what we're trying to do is create essentially a baseline of your optimal state for sleep and then help influence your brain so that you get the best quality sleep that you can get. And so when I came on board, I looked at the research, looked at the IP, looked at the category. And we talked about Fitbit. At Fitbit, we sold 140 million devices, as I mentioned. Sleep by far was the most engaging feature of anything that we did within our experience. And so I knew there was a ton of interest. I mean, we introduced sleep stages to general population consumers, which our scientists hate because now it's very generalized in a way that isn't specific to the way scientists look at sleep. But that's what we did. So I knew the size of the category, but what they were doing was so unique and so specific that I said, look, we're a startup, we can't go too wide. Let's focus on sleep. Let's build the brand around sleep. We're rolling in an enterprise, so we'll plug into corporate wellness solutions. I've said this publicly. We have a plan to introduce a healthcare variant of our product that goes to the FDA, and so your doctor can prescribe it. Because right now, doctors only have two tools. They have CBTI and essentially sleeping pills for insomnia. And right now we actually have over 1,700 doctors that are recommending Somnee to their patients. They can't prescribe us because we haven't gone through that process. But sleep is 1 in 3 people struggle with it, depending on the number. It's somewhere between 70 and 100 million people just in the U.S. And it's not just a U.S. problem. We saw this all over the world. Fitbit was in 100 countries. So we knew how much interest there was around sleep and what was happening with sleep. And, if you think about it, the brain is the last great mystery of the body. And so sleep is such an important part of that. It's physical health, mental health, general health, obviously performance. It is the baseline for health. And so if we can build the brand around that and introduce, great products, that certainly opens the door for us to start looking at other areas. And we certainly have our eye on that.
In terms of, you've mentioned so far, some kind of traction in athletics with the NBA investment and sports teams. Talked a little bit about potentially looking into healthcare, getting out, relaunching the kind of reimagined second generation device. Like, what is working now in terms of traction? What is resonating with people? How are you reaching them? And just like, yeah, what does that actually look like once it's, well, one, getting the attention and kind of buy-in from people that such that they're purchasing the device, and then the kind of feedback and results that you're seeing?
Yeah. So we're having a ton of success with people that are struggling with legitimate insomnia, and because they've tried everything and frankly, most people don't want to ingest anything. They don't want to take pills. CBTI is great, but there's a ton of friction. It takes over 6 weeks. You're speaking to a therapist. There's a lot of work you have to do. But once you get through it, there's success. But most people don't want to do that. And so, we have a lot of people that have been taking bad medication like Ambien. They're literally addicted to Ambien and they can't get off of it. And so, or they're taking, some other medication, which they don't want to do anymore. They just didn't have another solution. So insomnia, we have a category, sleep sufferers, and then we have sleep optimizers. Sleep optimizers are in that bucket. Certainly the athletes fit into that, but we have a number of high profile executives like CEOs and venture capitalists that are using our product. In fact, little kind of side story, when I first started here, our customer support, we had an inbound from a guy named Mark Benioff, who's the CEO of Salesforce. And I'm like, I think that's Mark. And he reached out. And so I followed up and I was like, hey, I think this is you. I am now the CEO, because we worked together at Fitbit. And he's like, oh my God. He's like, Somnee has literally saved my life. I've tried everything. It's the only thing that's helped me fall asleep. I have my wife using it, my team using it. And I'm like, that's, that's great to hear. And, we're raising a seed round if you want to come on board, which he did. But the point I'm making is that there are a lot of high profile people that understand the importance of sleep. And, the whole category, I think when I looked at it, everyone talks about sleep itself, but really what we're focused on in our strategy is about, in fact, our tagline is sleep more, live more. And it's really about the benefit of sleep, like what that allows you to do. And from a storytelling perspective, it gives us a lot more freedom. And you asked about the athletes, they're all about performance optimization, any advantage they can get. And especially when you look at, right now we're working with the NBA. We're in discussions with pretty much every sports league at the moment. Athletes are incredibly knowledgeable about the latest technology, latest innovation, the research. They just want any kind of natural edge they can get, right? So they obviously don't want to take drugs. They can't take drugs, at least some drugs. And they're trying to figure that out. And I think it's no longer about just recovery. It's literally about understanding even the quality of sleep, the stages of sleep that you're getting, understanding that if you have an injury, how important deep sleep is to that recovery process. Or, if you're a pitcher and you have a 4-game rotation and you're in the playoffs headed into the World Series, understanding how do you think about REM sleep so that you can lock in and have that mental focus. That's the level of understanding around sleep that we're working with these pro athletes. And it's absolutely incredible. And, we're kind of the perfect product for them, especially NBA and MLB athletes, because of the length of the season. They're traveling between time zones. And, we learned this actually not from NBA. We learned this through an Olympic swimmer who designed his entire bedroom around sleep. He had an 8 sleep, blackout curtains. He had light therapy. And his name's Ryan Murphy. He's a 6-time gold medal winner. And he was a national champion at Berkeley. Apparently he did research back in the day with Matt and I think Dr. Knight. And so we had no idea that he was using our product. And he started talking about it, about how important a product like Somnee is to athletes, because they can design their entire room around sleep and getting that optimal, sleep. But when they're traveling and staying in a hotel room every other night, they don't get those same benefits. So having a tool that can help them fall asleep and stay asleep is critical. And so when you think about the NBA, the length of the season, almost every other night, they're in a hotel room. So being able to provide a product that, it can be a crutch for them in helping them, manage their sleep. That is, everyone knows the importance of that.
This episode of the Fitt Insider Podcast is brought to you by EGYM. EGYM makes some of the most innovative strength training machines on the market, but that's only one part of their integrated ecosystem. With connected fitness equipment, AI-powered gym software, and a comprehensive corporate wellness offering, it's forging the future of preventative health. Partnering with companies worldwide, EGYM's WellPass program improves employee health by expanding access to premier fitness and health facilities. Upgrading gym floors, EGYM equips every operator with smart equipment and AI tools to create hyper-personalized training plans for every exerciser. Putting it all together, they're transforming healthcare through exercise. Experience the power of EGYM's ecosystem at egym.com. Yeah, this evolution of what we've kind of referred to as like trickle down health, or like just even the evolution of a product from the elite athletes, kind of high performers. You mentioned the sleep sufferers and the sleep optimizers. I think that's super interesting as it relates to like what you're seeing in your customers. But then how and well, can it get to mass market? Like what does that journey look like? Something like Fitbit was able to do that, as you mentioned, kind of like, you don't want to say dumbing it down, but like really distilling a lot of these different metrics and gamifying it and streaks and badges and competitions. With something like this, it's like, do I really want to be, kind of competing with sleep, maybe like leaderboards and different things like that. But is in your mind the aspiration just like, hey, yeah, Fitbit at one time we did 140 million devices. We want to have 140 million plus Somnees out there. Or is it more, hey, we have to really, really nail it with athletes and then really perfect it with insomnia. And if we do that, it will kind of take care of itself as it relates to different populations. How do you think about that?
Yeah, so it's a good question, and what most people don't realize is that obviously Fitbit became a top 20 consumer brand. It was, it's still, I think, the second best selling wearable, even though Google has been just killing it off slowly. But the reality was that at one point when we were building the brand in the business, as a startup, I had Chuck Schumer saying in DC that Fitbit was the demise of healthcare in America, because here was this new category of products. You wear it on your body. It's reading your body, understanding your body, and the risks around data protection and privacy and all that. And fortunately, one of the first things that I worked on when I came on board was we hired the Electronic Frontier Foundation, which is a public advocacy group for data protection and data rights. We worked with them on our privacy policy. We saw data as a strategic opportunity competing against some of these bigger companies. And we were never going to sell advertising on Fitbit. It was against everything that we believed in. And Fitbit was designed to be, by the people for the people. And so when we went to DC and we educated Chuck Schumer, and then we had President Obama wearing a Fitbit. And the next thing you know, we're running step challenges between Republicans and Democrats, and everything was great. The point I'm making is that it was a new category of products. There's a lot of education that you need to do in order to create the understanding, the value, the benefit, all of that. So it's the same thing. I view it the same way, which is, working, fortunately having the NBA approach us and NFL and all these other leagues. I think it's a great validation point, especially as you see pro athletes. As I mentioned, right now we have over 1,700 doctors recommending us to patients. We have clinical studies that are published out there. We have four of the most renowned neuroscientists in the world that started the company. And so my job is obviously to slowly, because, Fitbit was great. We were a tiny company for a while, and then we started to have a lot of success and momentum, and we just chased that growth. Here, it's a little bit different in that I have to do more education. It's a slower process, but I can guarantee, getting through the next milestone of our Series A fundraising, that this company in this category will be worth far more than we were at Fitbit. Because if you think about it, it's a product that is providing clinical data, but it's providing an intervention. It's a closed loop. It's a diagnostic and therapeutic product that is actually fixing something that 1 in 3 people struggle with. And so sleep, the problem that I see is that there's been so much bullshit and monkey science, and you still have even people in our category saying this and that and the other. And it's just, it kind of hurts the category, to be honest. And, there's a lot of, like I said, for a while, I was taking melatonin. I had no idea. But like what that was doing to my body, melatonin is a hormone. You walk into a CVS and you see like, the kids aisle and kids medicine, and like half of it is melatonin. And now I'm really big about, as a parent, making sure parents are not giving melatonin on a nightly basis to their children. It's a hormone. You start adding hormones to your body stops making those hormones. The point is that there's a lot of education that needs to happen. The thing that's unique about this company is we're doing this in sequences based on milestones tied to fundraising. And so, we have a 3-year plan and a 5-year vision. And, I actually think this company, the way I'm building it, is the ResMed of insomnia. We own 50 patents on the most effective form of neurostimulation to not only help you fall asleep, but stay asleep and improve overall quality of sleep. ResMed is a $35 billion company that did the same thing. They owned all the IP around the most effective form at that time for sleep apnea, which obviously what we do, insomnia is neurological, apnea is, basically it's an obstruction. And so they're obviously a massive company at this point. In fact, we have a number of customers that have both. It's called COMISA when you have apnea as well as insomnia. And so there's some interesting things that we're doing around that as well. But again, to answer your question, it's a slow go to do this education, create the awareness, build the credibility. But I know there's going to be a tipping point where it's like, okay, it's, this is now like a legitimate product that has scale. And certainly we already have commercial viability. It's just I think, again, the brain is the last frontier of the body. There's neurostimulation. Most people don't really understand that. I mean, I worked in the category of wearables and I didn't understand it until I came here. And then I was like, wow, this is, but I think it's education, it's PR, it's storytelling, and then having, pro athletes and leagues using the technology for performance.
Maybe a couple more questions before we wrap up. Just one down this path of, I mean, I agree 100% with what you're saying in terms of this closing the loop and there being a wearable, but there and the therapeutic in that it's not, you're not just tracking for the sake of tracking. There's so many devices, and certainly the initial wave of wearables is, yeah, you're getting all this information, but what do I do with it? Like, am I getting healthier? Am I improving? Yes, I'm taking more steps. What does that mean? And certainly the category overall has evolved in a way where it's getting closer and closer to outcomes. Like, what does this mean for me, personalized, all those sorts of things. That raises expectations, that raises awareness among consumers that these types of things exist. And so they start adapting them when their protocols. Do you think there's a ceiling on, I have my wrist worn device, I have my ring, I have my mattress that tracks this? Like, do you think we're moving in a direction where, yeah, people have 3, 5, 8 plus devices that are tracking them for different ailments, and maybe we put them all together? Or do you think it's going to be more focused in terms of, yes, I'm using this for sleep because I have a specific problem around sleep and I need to get this solved? Or just how does that evolve in terms of just consumer willingness to buy more different devices and track more and different things?
I feel like Somnee represents the next wave of wearables where you have those clinical data sets, but we're unique in that we provide an intervention, right? That to me is well, one, just getting clinical data sets. I think everyone's talking about AI right now. And I mean, at Fitbit, we were talking about that like 12, 15 years ago. I mean, part of the reason why we sold, I put together the strategy when we're looking at selling the company. And I was like, we should do work with Google because they have Google Cloud. We can basically take AI, like fully integrate it into our tech stack, because we knew you get churn and drop off when, if you cannot provide an intervention or an outcome. Like, it's great to have basic information, that's fun. There's a novelty in that. That's table stakes now. Then you have like insights. I think that's great. But it's really about, how are you helping me achieve the goal that I have? And everyone is unique and different. Like we talked about, if you're a pro athlete and you really struggle with sleep, I mean, we had a call a a couple months ago from, the Boston Bruins about guys that have insomnia on the team and they don't want to take drugs anymore. Like, how can we work with them and help them? We see this all over the place, but I do think that everyone is unique. If your goal is weight loss, then that's what your goal is. You're going to sort of optimize the devices that you're tracking around what your condition is and what you're trying to solve for. So I don't think there's one way to answer that. Like, for example, we know this. I think heart rate is tracking that on the finger is one of, outside of the chest strap, the finger is the second best place, especially compared to a wrist. And so if you're someone that really cares about heart rate data and how you optimize around that is like the most important thing, then you're probably going to want to have a ring or, use a chest strap when you're working out. Cause, for a while I was doing CrossFit and trying to wear an Aura ring was not, it's just not good when you're using barbells and dumbbells and whatnot. But you know, so to answer your question, I do think there's a whole ecosystem, and that's what we're doing right now. We're introducing an API. We're in conversations with some of the wearables. We announced the NBA. Our data will plug into the performance platforms. We announced Equinox Hotels. We're building a full integration with them, so Somnee will be in every room. As I mentioned, we'll be plugging in their wearables. We're looking at blood biomarker companies and how that plays a role into this. So this is, a Fitbit I launched works with Fitbit. It was a whole ecosystem of researchers and companies that wanted to use our sort of basic API data sets. Companies built businesses on our data. And so, I see that as an important thing. And, for me, I'm wearing multiple devices. Although I have an 8 sleep, I'm kind of pissed at my 8 sleep right now because I think the algorithm's off. Because for the last 3 nights, I've woken up in the middle of the night because my bed was like way too hot, and so I think there's something up with autopilot. So that's been a little bit frustrating, but I think your point and your question is a good one. Everyone has their own unique goal and objective. And so the great thing is you can start to optimize the best sensors, the best location of sensors, the ecosystem, the services that are going to help you achieve what you want. In our case, we're really unique because we are legitimately closed loop. So if you're someone that 1 in 3 people struggle with sleep, we're a great product. It's an easy product to use. And you can either use it for 15 minutes because some people don't like having something on their head while they're sleeping, or you can wear it all night and get that, even more benefit of doing that. And so that's my position.
You kind of beat me to it in, kind of what's on the roadmap, where you headed. A lot of kind of partnerships, the API, the integrations with blood work. You mentioned potentially targeting the Series A and the different milestones. But when you think about what you're talking to the team with now, or what's kind of like top of mind, what things are you thinking about when this comes out? It'll be early 2026. So yeah, where does that put Somnee, and like what are you kind of tangibly working towards? Like, hey, these are the KPIs that we really need to check off and focus
Yeah,
on.
for us, it's about engagement, managing, activation, engagement, the process, providing the best possible app experience. I mean, the hard thing is we're a tiny company. We're like 20 people building this out right now. My number one priority as a business is to wrap up our A round. Like, we have no shortage of company like VCs and pro athletes. I mean, 2 weeks ago, we had, the most famous golfer in the world reaching out to us. We have like NBA athletes, NFL athletes, but my priority is to secure the best possible lead investor, because obviously they're going to have a board seat. They're going to be really important in helping us execute the next wave and driving the strategic vision. So right now we're focused on the best that we can provide around the experience and engagement, but I can assure you that this is nowhere near what the level of information and data and experience that especially even within next year with our roadmap for 2026, there's some really exciting things. And then, as I mentioned, we'll introduce our API. So we'll have an API for researchers, and then we'll have an API for strategics and building out, starting to build out that ecosystem. But, yeah, that's kind of where we're at. KPIs that are most important are driving engagement, driving awareness for what's happening, keeping them on their journey, because, ultimately it takes us about 2 to 5 sessions to establish a brain baseline is how I describe it. Once we have that, we can really move into the personalization and optimization end to end. In order for us to sort of perfect what we're doing, is it takes about 21 sessions. And so it's getting people to understand, and the AI models are testing different frequencies and trying to really optimize and tweak based on, what we're learning about you. And so some nights might be better than others, but you get through that 21 session experience with us and we have 85% success rate. I don't think there are pharmaceuticals that even have 85% success rate. And, our agenda is, we don't want doctors prescribing pills. We want them prescribing Somnee ultimately. But that's what the vision is for where we're going.
We will certainly keep everybody up to date on all Somnee developments, what's going on as you roll out new things. But if they want to follow along, try the product, just keep up with what you have going on, where would you point them?
So our website, it's a great place. It has all the information. You can obviously purchase the product. You can read testimonials, watch testimonials. You can look at the clinical studies. You can learn more about Matt, Dr. Knight, Dr. Irie, and Dr. Ram. And so, yeah, there's a lot of great information there. We're publishing nonstop on Instagram. Instagram has been a great channel for us, obviously LinkedIn, et cetera. But I would come to somneesleep.com to learn more about, what we're doing as a company, and then learn more about the product and then test it for yourself. We have a free 45-day trial. So that allows you to go through the full session and full experience. And if, you're outside of the 85% that we have success with, then you can return it, no questions asked, for a full refund.
Perfect. We'll make sure everything is easy to find in the show notes. And Tim, we're super excited to share this conversation. So thanks for being here.
Thanks, Joe. Appreciate it.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fit.co. And one more thing, you can learn more about our recruiting and consulting services at fit.co. That's FITT.co. I'll see you here next week.